Good evening, everyone. Happy Tuesday. Hope everyone's doing well. Welcome to our March I-CPEN / IPME meeting. We have a lot in store for you guys today, so hope you have your listening ears on, a notepad next to you to take some notes. And with that, I will pass it to Garth.
Thank you, Lauren, and good evening, everyone. And again, welcome to our monthly meeting. And we got a packed meeting tonight, so I'm going to make it short and get our guests introduced, and we're going to go ahead and get started. We're welcome tonight to be joined by Dr. Usaifa Master, who is an IPHA member and Midwestern graduate, and he's currently the Director of Clinical Pharmacy Services at Centene, and he's got a great opportunity and program that he wants to talk with you with, and also that some of our members are already involved with, and they're going to be sharing some of their experiences as well. So I'm gonna pull back and we'll turn it over to Seifa.
Hi, thank you, Garth. Like Garth said, my name is Josefa Master. I'm the Director of Pharmacy for Meridian of Illinois. In that, the parent company I work for is called Centene. I oversee the pharmacy benefits for multiple areas. So we have Ambetter, WellCare, Meridian of Illinois, Medicaid, and also Use Care Medicaid as well. So, kind of a wide variety of government-sponsored programs. I've talked with many of you regarding how we function in Illinois and kind of the services and programs that we offer. So first, I want to thank IPHA and Garth for allowing me to present this information. We're excited here to show you what is offered. I'm really happy that we have an exciting program. We have a little bit, just as a quick background, we have just an introduction on the program itself, which will be presented by Stephanie Hale, who's from PQS. And then after kind of the background of the program, we have a panel discussion. So myself, I'll be moderating the discussion. We have Andy Hudson, Rupesh Manak, and Jignesh Gandhi, who are kind of go over their experience with the program. So you guys can kind of learn directly one-on-one from your peers of how the program works and kind of how you can incorporate it into your day-to-day activities. So with that, I'll throw it to Stephanie to give us a background of the program. Thank you.
Thanks. Hi, I'm Stephanie Hale. I am the Quality Programs Manager at PQS. Most of you probably know us as EQUIP, which is our dashboard that we use for patient adherence. So just going to go through some of the program here. Let me share my screen and go through some of the program as well as some of what is in through EQUIP as well. Let me get there. Okay. So just going to go through an overview of EQUIP and then our program with Centene, and then also, like we said, a pharmacy panel discussion on these programs. So EQUIP historically has provided performance data for Medicare Part D patients. We also have some marketplace plans in there as well. So most pharmacies recognize us to provide those outliers or patients that are negatively impacting your performance score, and in turn, in the past, impacted your DIR scores. So a lot of pharmacies ask us now, since DIR fees are taken at point of sale, how does this impact EQUIP? Or I don't need to focus on patient adherence anymore, which is not the case. A lot of health plans, including Centene, have performance bonuses available that we'll get into, as well as other revenue generating opportunities that just impact the patient's overall health. So this here shows basically what our website looks like when you first log in. And again, you can look at specific measures who would be, for example, impacting your cholesterol PDC scores, the patients that are involved in that. And then we also, I'm sorry. Oh, sorry. And then also we'll get into the revenue generating programs and where you can locate those in the EQUIP dashboard. So historically, you can go in and things are updated year to date, available May through February of the calendar years, when year to date data pops up. Like I said, historically, you were just able to view the outliers that were impacting your score, but now you can actually see patient details and see all the patients that are involved in each plan, which plan you have the most patients attributed to. So again, impact, how you can impact those patients the most, and again, earn some additional revenue as well. So last year we had a program with Centene for a couple things, for controlling blood pressure, and then a longitudinal adherence monitoring program, which we call LAMP. And then had a lot of success around that, helping pharmacies generate additional revenue, and then also, improving patient health outcomes. And so there's even more revenue available through these programs and new programs this year that you can earn additional revenue through. So there's 3 programs that we have available through Centene. There's a quality network program that evaluates the overall performance of the 3 core adherence measures. There's a formulary adherence program as well, which is the first of its kind. I know previously there's been formulary formulary adherence type programs where you get a one-time fee for converting that patient over to the formulary drug. This is much different in that it's a shared savings program. So for each day that that patient is on the medication that is preferred, the pharmacy gets that savings back that Centene is sharing with them. And then, like I mentioned before, there was enhanced services that include our adherence program, and as well as the blood pressure program as well. So to get into the quality network, when you log into the Quip dashboard, these programs are going to be under My Programs, and there's going to be a $sign that you click on. If you click on that, it's going to take you to this page, and it's going to show you all of the program details, what the tiers are, etc., and then what opportunity is available to you. And then those outliers for those patients will be popping up shortly, and they'll be reviewed on a weekly basis. Another program that we have here is the formulary adherence. And like I said, this is the first of its kind. There's 11 different drug classes, and there's 2 measurement periods. So there's a January to March measurement period that's happening right now, and then April to December. So each of those market thresholds must be exceeded to begin earning those bonus dollars. But if you go in there, it'll show information that's tailored to your pharmacy, so you don't have to look for specific drugs, just through the dispensing process. You'll be able to actually view those patients of yours that have opportunities to be converted. And this will also be refreshed daily. I know historically we've had monthly updates, and it's kind of an in the rears process, but now we're getting data from payers more frequently, and some of these programs are updated weekly. In terms of enhanced services, this is going to be if you have a bullseye located there, which no one has a bullseye right now. Those will actually come in April. But as you have opportunities, you'll see a bullseye pop up in your dashboard. And any of those opportunities in this area here have to be documented to earn dollars. So the one program I talked about, the longitudinal adherence monitoring program, it has patients that are in those 3 core measurement, so RASA, diabetes, and cholesterol. And then there's also this year, there's going to be statin gaps as well. So you'll see those pop in. And this offers a check-in through the pharmacy. So as we know, pharmacists see patients more than anyone, and have that more of that one-on-one communication than a doctor would. So it's just checking in with the patient and seeing things that you already do most of the time. So just checking to see how their medication's going, if they have any questions. And as long as that's documented in here, and those patients will come up eligible here in this longitudinal monitoring program. So you would click on that. It's going to show your list of patients that Centene has marked as eligible for this program. And then once you go in and have that conversation with the patient on a quarterly basis, you can earn incentives back to your pharmacy. And those incentives are paid by us to your PSAO or your organization, whichever that might be. So you'll see those in there. And then they'll also offer opportunities to switch to extended day supply. And then there's also at the end of the year, there's what they call a final fill program. So these patients are typically your most adherent patients, and they just need that one last fill of the year to become adherent for the year. So those will happen, and you'll have opportunity to document on those and, like I said, earn additional revenue. And then the controlling blood pressure program, as we know, especially during COVID, pharmacists really stepped up and were able to do services that were needed in their community. And so these patients are deemed, they're blood pressure patients who are in need of clinical intervention. So maybe they haven't been to the doctor's office to get a blood pressure in a while. So at that moment, they pop into the queue here, like I said, under the controlling blood pressure program. And then either yourself or any pharmacist or certified pharmacy technicians can also do this. I know a lot of times the pharmacist thinks they have to manage the data and equip, but it's great to have your technicians involved as well. Can capture a digital reading. So if you have a Higgy machine or any type of electronic machine in your pharmacy, you can have that patient sit down, collect that reading, and then discuss the readings with them and get paid for those documentations. Even if you have just a regular cuff that is electronic, that works as well. And so how can we get your pharmacies involved in these programs? There's three things that we make sure, especially in this time period when those programs are just launching or at the beginning of the year. One, make sure you have access to equip. So you can contact us directly at PQS, or you can reach out to your PSAO to make sure you have access to the dashboard. And then review those program opportunities now in My Programs. Those are available. And then, like I said, starting in April, you're going to see additional dollars unlocked in that enhanced services. So those bullseye will approach, I believe, that's going to be launching the first week in April. So look out for those opportunities then. And then how can you engage your staff? We always suggest recognizing or assigning a quality champion. So is there a technician there that wants more in your workflow to be able to do more with patients, et cetera, that they can log in every Friday when opportunities update and make sure that they're assigned with contacting those patients to come in for a blood pressure reading, or having them reach out, see if they need their blood pressure medication refilled, anything, and keeping those documentations going as well. Establish your goals and how you want to do this. A lot of pharmacies are really making a dent in these revenue dollars that are offered by the health plan. And then we also have text messaging as available as well. I know Jignesh is big on our text messaging program. He's responded to me with that some, but just scan that code there, and that'll give you weekly reminders. So you'll only get a reminder when you have opportunities available. So if you have blood pressure readings or lamp opportunities, you'll get just a simple text message that says, hey, you have opportunities in equip, log in to do it. So just having that simple reminder is been really big for pharmacies. So feel free when you get the slides to sign up for yourself or send it on to your friends, whatever, but it's always helpful to have that extra little reminder. And then we also offer demos as well, which you can reach out to support@pharmacyquality.com, and they can go through a demo with you, looking more at your data, et cetera. So I'll go ahead and pass it back to you.
Thank you. Sure, great. Thanks, Stephanie. I really appreciate that information. I really appreciate the sign towards the end too of like how to incorporate it into your workflow and some of the best practices. So wonderful, wonderful. All right, so I'm gonna share my screen. We're gonna get started on the panel discussion. So give me just a moment to get everything set up. Okay. So for our roundtable panelist discussions, we have Jignesh Gandhi, who's currently the CEO of Holy Plaza Pharmacies. His pharmacies serve all communities to achieve the most positive outcomes with the long-term goal of benefiting patients without compromising on the cost of medications. He's worked in 340B federally funded programs to provide medications to those in underserved areas. The next panelist we have is Rupesh Manik. He's the current owner of Amboy Hometown Pharmacy. He's a dedicated pharmacist practicing an independent community pharmacy setting for over 25 years, active in many organizations, current trustee of AIPHA and chairman of the IPHA board. And finally, we have Andy Hudson, who's a graduate from Purdue University School of Pharmacy. He's a third-generation pharmacist at Hudson Drug Shop that recently celebrated its 75th year. So I'd just like to kind of throw it out there to the panelists. We'll start with the first question of, can you describe the software's function? Meaning, how do you use it? How is it easy logging in? What is the documentation like? So we'll start with Andy, and then we'll kind of go back up.
Okay, I thought once you log into I-CPEN website, it's pretty easy to use. Just on the left-hand side, you can find your program pretty easily, and then you can actually download your, if I remember right, your patients into a spreadsheet if you'd like, and for the various programs, and kind of identify through your workflow how you want to contact them. So found it pretty easy to use.
Great. Well, that's good to hear. Yeah, I think, when PQS was talking in the I-CPEN platform, they're saying that try to make it as easy as possible, because you make it cumbersome. And, I kind of remember back in the day when outcomes first came out, it was a tedious process to go through step by step, documenting all those CMRs and TMRs. So I'm glad to hear that it's easy to use. Rupesh, any other comments on the Rupesh or Jignesh? Any other comments on like the functionality?
Yeah, personally, I use it almost every day. The screen is always open on my computer and my lead tech's computer. The trick is knowing when there is a patient, and it gives you that cheat sheet. You know who you need to approach. It gives you a guideline. Hey, you need to take care of this patient. And once you have the guideline, it's very easy to work because of our relationship with our patient. When we are busy filling prescriptions, sometimes we forget a patient falls through the crack. This program has made things a lot easier, that if we miss something, it helps us catch up with that. So I definitely would say keep it open all the time. You will be able to see what's happening or what you're missing out on.
Great. And Jignesh, any other final comments?
No, actually, what Andy and Rupesh said, I think that this is the most easiest software we have. And what I do, I have my technicians, I assign to one technician, and she coordinates everything with my all other pharmacies. So that way we don't miss any opportunities over here, So we can plan with Mr. Johnson, if he's coming to the store or not, how can we coordinate, get his blood pressure reading. And so, but the ease of the system is so easy. I wish there was an interface with the current pharmacy system, but it doesn't matter. We go through cardinal ordering system, and it works. It works.
It works. Good. That's good to hear. I mean, I think, I'm sure Stephanie might take that as a quote saying it's the easiest software to use. We might come back to you on that one again, but I'm so glad to hear that it's really simple to log in and start kind of using the software. So you guys mentioned a few things, and I think Stephanie mentioned it too, is that not only are you getting pharmacists to do this, to log in and document, but you're using technicians as well. So can you talk to a little bit more about how you introduce that information to your pharmacists and your technicians, and how they've kind of bought into the program? We'll start with Jignesh and then go back down.
See what I did, when this program came out, I've been talking to I-CPEN I think you guys know me for a while now, and I always love your services. It helps patients and pharmacies both. So what I did, because now pharmacy technicians can do a lot more job than they used to. So I like to always, empower my technicians. Hey, can you get this? Can you get the data cover? Can you get the readings done? And then finally my pharmacists go over to counsel the patients. And it makes job easy for pharmacist, because he or she doesn't have to wait, utilize the time into I-CPEN and he or she can also give other, like taking care of the patients. But at the finally, pharmacist can play his role and save the time and achieve the outcomes that we want to achieve for our customers,
Great,
To
great. Rupesh.
Yeah, to add to that, I mean, the one thing that it's a very color coordinated platform. When we began with using our technicians to help us out with this, the main thing that they worked on, they saw a red score, and if it's not green, it's a problem child. That's how we started out. And they would identify the outlier patients and bring that to our attention, to the pharmacist's attention in our team. And we basically troubleshoot those patients. And the whole idea is to get as many greens as we can over the reds. And it was easy to explain. If it's red, it's bad. Let's work on those. If it's green, we are doing okay. So just easy, get them involved. And as time goes and they practice, they were starting to see what the problem was. My technicians have started looking at patient profile to identify where the error is. And almost when they bring it to my attention, they know what the problem is, why it happened, and how we can fix it. So by the time I talk to the patient, I don't have to do much. Technicians have made things easier and faster for us to be able to counsel our patients.
Wonderful. Andy, anything to add?
I guess I would add, I've probably not been as efficient as the rest of us here, in that I've done a lot of it myself, probably been overstaffed on certain days where I've had the time myself to kind of address some of the things. But one thing we talked about doing is, like, everyone has those tags they put on the bag if an item's in the refrigerator or you need to mix an antibiotic. So we talked about making another type of tag that would stand out on the prescription bag when they go to pick it up, that this person needs to have some extra counseling on their compliance or blood pressure taken or whatnot. So we kind of can fit it in the workflow that way, and we can use the technicians to help us out with that too.
Great, great, great. I think it's great that you guys are using the pharmacists, like practicing at the top of their license along with the technicians as well. One thing that some of the people on this call have multiple pharmacies, right? And so Stephanie, I'm gonna throw it to you and kind of ask you here: is there a way to get a multi-store login? And if so, what is that process?
Yeah, so there are opportunities for you to get a multi-store login, and typically what happens is whatever PSAO you're with, you can request that for them, and then just make sure what the impacted MPIs that you want for that person have the same email address. So if you have 4 MPIs that you want to take a look at, you'll need to have the same username or same email address associated with those.
Okay, cool. Sounds pretty simple, relatively simple to do, I hope. But yeah, I definitely think that getting the multi-store login is helpful, because like Jignesh said, you got one person coming in and you can kind of see across the entire platform of what other pharmacies they might be going to, and you can capture that in different areas. So that's great.
And if I may suggest, and there is another way to do it. If you call Cardinal or your another wholesaler, create your own login with them for multi-store users. From that login, you can switch any of the pharmacy order express to go into the I-CPEN portal. That's just another way to do it.
Great, great. Thank you for that.
Yeah.
And so can you guys tell me a little about the feedback you gotten from your staff around this utilization? It's increased job satisfaction, and maybe kind of gives them something different to do, breaks up the monotony of filling prescriptions. So we'll start with Andy, and then we'll work our way up.
Sure. I've discussed it with my pharmacists, and they're happy about it and something different. But I think more importantly than that is my son would be the 4th generation owner here at some point, and he's in his first year of pharmacy school at Purdue. But I love to see these kind of opportunities, because I feel like these younger students, when they graduate, they're looking for something more clinical to do than just checking prescriptions all day. So with these types of clinical opportunities, it makes me look forward to where the profession's going, and that we can get paid for some of these opportunities. And it sounds like there's more coming as well. So we do appreciate that.
In my
Absolutely.
store, I've seen the pharmacist that helps with the blood pressure monitoring and counseling. There's some professional gratification on that part of it. Sometimes looking at adherence, kind of gets boring for the technicians. But I think the more advanced services or enhanced services that we can do, I think there'll be more professional gratification. We don't get as much opportunity, but we would like to have more opportunity on that part.
In my pharmacy, I'm all about pushing my technicians because pharmacists, as it is, they have enough things to do. So my technicians are certified in a lot of things. Like they love to do equip where they can count, where they can just go talk to patients. They do vaccines. They do a lot of other things. So in my store, they are all like, "Can I do this? Can I do that?" So nobody wants to count the pill anymore. So I had to get the robot for them. So that shows how much they are into these services, and they're very happy actually. They're very happy. They love to do. And like Rupesh said, we have a tab open every single day. Every single day, equip other tabs, whatever we need, it's all open. So everybody can see which patient needs to take care of, to be taken care, what needs to be done. So my staff is very happy to participate in all these services.
Wonderful. Yeah, I'm so glad, you guys, it sounds like a lot of positive feedback from the staff. And, Jignesh, you're kind of like moving it forward by automating the counting of the pills that no longer has to be done by hand. And you're allowing your pharmacist and your technicians now to kind of do some of these more clinical activities that these new grads are being trained to do. So that's great. So we've talked a lot about the successes. Can you talk a lot of something about your challenges that you faced when you're dealing with this and trying to implement this kind of program? Jignesh, we'll start with you and then work our way down this time.
My biggest challenge is, patient, the doctor, when he denies, okay, for adherence report, you know what? I cannot see doctor. Doctor would not approve the refills. So then I miss because of that. Then another challenge is, let's say, blood pressure. We deliver medication to patient's house. Now what we do? I cannot send my technician or something or call the patient to come over here. So those are the hurdles we have. I don't know if the virtual is allowed anymore or not. Down the road, it will be allowed or not, but I wish. And other than that, no, I think I don't see any kind of problems to serve my patients. Yeah.
Wow, interesting. Rupesh and Andy, any other challenges you faced in dealing with this program?
Personally, I would like to see in the future for there to be some inbuilt forms on the platform. Like when we do blood pressure monitoring, we should have attestation forms that we have covered, what we have covered, a quick guidelines of what should be covered with those patients. So a resource bank that we can use, and just after we are done doing data entry, we should be able to print or get patient signatures and keep that for our record.
I would just echo what Janice said is we have a lot of our patients are delivery patients. So if we can figure out a way to help monitor their blood pressure and those things, and those patients that maybe are not able to get to the pharmacy, that would be something we would,
Yeah,
a
absolutely.
challenge.
Yeah, and I know the blood pressure part is it's a little different, right? Because it's technically not medications. And we have signed on as an organization to help to try to get these blood pressures documented. And so I really appreciate you guys kind of going over, and I'll let Stephanie talk a little bit about the blood pressure
chime in, that is feedback that we have received from several pharmacies just throughout demos or meetings at your trade shows and stuff that we're at. We've gotten a lot of feedback with that, and it's definitely on the table, and that's been something that we've talked with Centene, other especially with Centene, but other payers as well, about piloting some virtual appointments as well to see how we can get that stuff those gaps closed with patients, because like many of you have mentioned, this is the trend that the industry is going. So not only are we trying to get blood pressure readings, but cholesterol readings will, I'm sure, be there. Social determinants of health and those surveys I also see coming down the pipeline as well. So there's definitely going to be a lot of opportunities for pharmacists to get in that clinical space, and that is a problem that will have to be solved for as well, that delivery issue.
Can I add one more thing?
Sure.
The thing is that a lot of pharmacies are missing the vaccine alert on the top upper left, upper right corner. A lot of people turn off that vaccine. It saves a lot of time. But because in Illinois, we have to get into iCare to find out which vaccines they are missing and which one they are due. So in this report, it tells you which vaccines patient needs, and that saves a lot of time actually, if you have turned it on in outliers.
Great. Yeah. And in addition to vaccines, so we talk about blood pressure, just mentioned vaccines. This year we're also going to introduce A1Cs. And so just obtaining A1Cs, you have to be a CLIA waived pharmacy, but you can also document A1Cs in the system as well. So definitely a lot of opportunity here to advance patient care and make sure that the patients are not only taking their medicines, but getting all the other additional care that they need. So, one of the last question I want to ask is, can you comment a little bit on how your patient behavior has been affected by implementing this program? Have you noticed anything like increase in adherence rates, people coming in more often, anything like that? So we'll start with Andy and we'll end with Jignesh again.
Well, a couple things. I think it's been a combination of the program, and then our pharmacies concentrated more on synchronizing patients' medications and multi-dose packaging. So those things all in combination have increased our adherence rate quite a bit over the past several months. So that's helped. And just kind of an individual story about checking the blood pressures. Well, most people, you check it and it's reasonably pretty good. But I do remember one patient that we checked the blood pressure and it was pretty high. And so we were able to do some consultation with him about checking with his physician, and that really, the consequences of having high blood pressure. So of the, I don't know how many patients we were able to check blood pressures, but there was at least one out there that we were able to make a significant intervention on. So.
In my stores, the adherence level has obviously gone up, and the other opportunity this platform has given, we have reduced the patients that have fallen through the cracks, because it helps with the training part of it. So overall, this has been a great addition to my workflow.
In my pharmacies, what I have done, every pharmacy has an open blood pressure machine. So because of this, like, hey, Mr. Johnson, you walked in, how you doing? Or your blood, your medication has changed or out of refills. So what we do in my pharmacy, every couple of months, whether Equip gives me the data or not, some people know, hey, can you just take my blood pressure? In old days, people used to go to Jewel, Walgreens, everywhere to take the blood pressure. What I do, I have kept the record. So what I do, like every 3 months, okay, Mr. Johnson came in January, in his profile, it was 120/70. Oh, next time he came, it was 130/80. Now it's 132. So that way it gives me data mining of patient blood pressure is going up. So we can tell the patient, hey, Mr. Johnson, you might want to talk to your doctor. Your blood pressure has been going up for last 9 months. So stuff like that. This Equip has given me other opportunity to talk to patients, and they love it. When you talk to these patients, they're loving it. Like, oh wow. And they don't mind waiting, because this way you can tell them, while you're filling the prescriptions, you are taking care of the blood pressure, and talk to the patient, give you a chance to talk to them. That's all. Overall, I have a good experience with this.
Great. And I appreciate that, because you guys are the independent pharmacists, and you guys are able to make that connection with the patients. I feel sometimes that some of the other pharmacies are not able to do that. So I think it's great that this is an avenue to kind of even establish a better rapport with your patients and making sure that not only are they taking the medicines, but they're getting all the other care that they need, kind of like the 360 view of the patient completely. So great, great, great. So I just want to thank the three panelists, Jignesh, Rupesh, and Andy, for taking time out of your busy evening and busy schedules to talk to you guys about, to talk to the membership about this program. And just as a quick recap, we do, once you log in, you have opportunities for medication adherence. This year we have formulary conversion opportunities. We'll have blood pressure opportunities. We'll have A1C opportunities. And so there's a number of opportunities here to kind of advance the profession of pharmacy in Illinois. So with that, I do want to share my contact information in case you have any questions about the program. I'm glad I'm the first one. And then this is kind of the box that goes to the entire pharmacy team for Meridian in Illinois. And so if there are any questions related to anything related to Meridian, you can shoot me an email or shoot an email to the pharmacy inbox, and they will gladly reply to it.
And
So again, I want to thank IPHA for the opportunity, and thanks Stephanie for agreeing to speak as well. And
yeah,
thanks,
thank
Stephanie,
you. Thanks for giving us the opportunity. I also put my email address in the chat if anybody has questions specific to equip.
It looks like we had a couple of questions. Byron, you've been patiently waiting with your hand up. Go ahead.
Okay, actually, I had three things. We have 4 remote pharmacies, and so for efficiency, assigning a technician at each of the home pharmacies to monitor what's going on at those, and then be able to give directives to the staff there to follow up. Does that sound like something that's easily done? Anybody?
So I can add to that, Byron. Because I
thanks.
also have a telepharmacies. Everything happens from my home store. All the data gets sent from home store, and the scheduling is done by the remote pharmacies on counseling, and then they give a feedback. So I mean, it's the same team that does everything from the home store. In my store, that's how we do it.
Okay, thank you. I noticed on one of the slides that it said maximum reimbursement was $100 for one of the services. Is that $100 maximum for a year, no matter how many interventions, or is it $100 per quarter?
Those will actually vary. That was just kind of like a demo site that we had it. So those will actually vary based off of whatever intervention you have performing. Check-ins are a certain amount. And those, once the program launches, you'll get an email with those details. And then also there's a link, you'll be able to see in the dashboard how much each opportunity is worth as well.
Okay. Last question. This has been our experience in the past. We'll call a doctor to get a diabetic patient on a statin or an ACE inhibitor, and the doctor says, no, I really don't want to put the patient on there. In my understanding, there's no way to document that in equip that you have done the service, you just penalized for it. Is that still true? It's been a while since I've worked the bench, so I don't know if it's the same now or not.
So actually, it just is going to depend again on the plan. In terms of CMS, that has gone to what they call the display measure. So it's not one of the criteria that CMS grades the plans on anymore. So a lot of plans have taken that out of there. In terms of that, there might be some incentive now if you want it. So you're not necessarily penalized, but there is incentive to switch that over. So for example, the program that we have with Centene, there will be opportunities for conversions to a statin, and then also for statin use in cardiovascular patients as well. So they'll have those gaps that will appear, and you'll have the opportunity to call the physician and have those prescribed, but you're not necessarily penalized for that if you don't get it. But if you do have a conversion, there is incentive based off of that, if that makes sense.
Okay. And the last thing, how do we sign up for this program?
So as long as you should have access through your PSAO, you have free access with your PSAO. So if you're, with Cardinal, McKesson, any of those, they all have access. You will have access through them. If you want to contact me on my username or my email address, you're automatically, as long as you're you have opportunities, then you are able to participate in the program.
Okay, thank you.
Like we had another question in the chat that I'm not sure if we hit on, but JD asked, would remote patient monitoring be an opportunity for the at-home patients that we deliver to?
Yeah, and I think we kind of touched on that as well, that there will be, hopefully, that's in progress of trying to get that taken care of with maybe some piloting and different things as well. And then it looks like there's somebody asked about if they had a medical assistant as well. So any certified personnel that works with your pharmacy, I know a lot of pharmacies have nurses come in and do vaccines for them, or they have a nurse or a dietitian on staff. Anyone that's certified medical personnel can complete those readings as long as they're digital. So you have the cuffs that you sell on your shelves, you can pull one from there, and the ones you just simply press a button, those you can have, or even just the the automated machines that you have in the pharmacies as well.
Any other questions from the group? All right. Well, thank you, everyone. And thank you again to Seifa and Stephanie and to our panelists and for helping bring some great information to our membership and to the network. And you should be getting a lot of emails and communications hopefully pretty soon. So I'll be glad to see a lot of the pharmacies starting to take advantage of this type of opportunity and seeing where it goes. So thank you very much for bringing it to us and helping us spread the information to our members and to the network. Thank you.
Thank you.
Great. Thank you. Thank you, everyone.
And I'm going to turn it back over to Lauren for the rest of the program. Stephanie and Hussefa, you're more than welcome to stay. And Andy, Jinesh, and Rupesh will want you to stay for your part is on the next, or Rupesh for the next part as well. So I'll turn it over to Lauren and Laura.
Thank you, Garth. All right, now some familiar faces will be presenting on naloxone. So Laura, take it away.
Awesome, thank you. Double checking that in just a second. The slides projecting okay, everyone?
Yeah, doing well.
Yeah.
It's in presenter mode.
Yep, let's try this.
Bingo.
Great.
Perfect.
Garth and Lauren, can you keep an eye on raised hands and chat questions for me in real time?
You got it.
Absolutely.
Thank you so much. Hi, everyone. I'm Laura Lakiri. I'm an associate professor at Roosevelt University in the Chicagoland area. And then I'm also IPHA past president and your current network luminary for I-CPEN, the Illinois division of CPESN. And we are excited to be hosting our third call this year, getting reinvigorated with our I-CPEN networks. So today I am going to give you a very brief presentation on naloxone dispensing. I hope for our team that is here that this is redundant and you're thinking, gosh, I already do this, so I don't need to know anything else, because this really is quite straightforward, and I'm going to lay out the steps if you are not familiar with it. I also have Harry Zollers, who is IPHA past secretary and current owner of Maryville Pharmacy, and Rupesh Manik, again, current chairman of the board and immediate past president and owner of Rochelle Pharmacy. So, as a quick, I would not be a professor if I did not give you a brief background. So just as a reminder, on October 2nd, 2017, we were issued a naloxone standing order, and that meant that we had the freedom to dispense with our power granted to us by our license and our training to be able to take the initiative to dispense naloxone when appropriate. I do have my sites at the bottom of each slide if you want to take a look a little bit into more detail about any of the information that's presented here. Of course, we were all aware of during COVID that there was an increase in opioid-related deaths. We also are aware that due to fentanyl contamination, we also have very recently increase in opioid deaths. I want to point out that for the first time, and this is fairly recent, we do see decreasing numbers of opioid-related deaths. This is due to us and to our profession and to everything that you are doing to dispense naloxone. So if you want an overview of where we are with IDPH, Illinois Department of Public Health, this is the website with an overview of our policies. Again, we will send out these slides with a recording of the meeting, so you will have access to look at them later. But this is a great resource to be able to holistically see all of the parts to this process. And with that, let's go ahead and talk about those parts. So a couple of notes. First, you have to be a participating pharmacy or pharmacist and be licensed under the Illinois Pharmacy Practice Act. Check, you're already done. You have to apply for a standing order. We'll talk about that shortly. You have to complete approved training in how to use naloxone. Again, you probably have already done that, and it's quite easy and quick. And then you also have to report your naloxone dispensing to Illinois Prescription Monitoring Program, or I-PMP. Again, resource at the bottom of this slide. Here's how you apply for a standing order. It is the website there. Here's a QR code to take you to it. You could fill it out on your phone, should you want to. That is how easy it is. Asks you a few questions about the location of your pharmacy, that you've completed the training, that you are essentially going through their checklist. So maybe a good idea to take a look at the form first before you embark on participating in this program. Second, you would want to complete the required training. Garth presented this information here for the training opportunity that is currently available through CDC. As you can imagine, it changes over time. So IPHA is currently working on our own training as well. Garth, also, thank you so much, included in information to me a PDF on the pharmacist role in naloxone dispensing, which I think would give you a good overview again of the goals of this program. Step 3, report to I-PMP. Pretty straightforward. I cannot help you figure that out, but we have a lot of resources in order to help you comply with this step. I also wanted to share additional resources from a friend here on the call, Steve Hemans. I think this would be helpful, the Naloxone Purchasing and Distribution Considerations Guide. This gives you, again, an overview of what options are available and what purchasing options, and again, how to use the product. That's it. So real quick, I do want to hear from my two guests to take this home. Harry, can you share with us your final thoughts on your experience with naloxone dispensing? And I know you have shared with me before that you're excited because this is taking a step towards cognitive billing.
Correct. At my last position before our family took on the aspect of owning a pharmacy, I had worked in a community that was really affected by opioid overdosing and exposure, especially being off of 55. And a lot of people know that highway. It kind of shoots right across the state. And unfortunately, communities like I worked in were very affected. And at that time, when the standing order just got released, that was one of the first things I wanted to kind of get going and allow, access to the patients in our area. I had even joined an organization called Naranon to be able to do a community focused approach on that. And all of that to say is there was so much work around more than just dispensing the box of naloxone. And I feel like at that time, it was during a period for reimbursement and perspective of the pharmacy where you could get by but just dispensing a product. And as we probably all know as pharmacy owners, now dispensing one box is not going to be enough to satisfy everything else around what you would need to do for naloxone dispensing. So there is promise that now, especially compared to what it was 8 years ago, that we have the ability to harness those extracurricular services that we provide for our patients on a daily basis and actually get paid for that. And I feel like the work that we're going to be doing with I-CPEN and CPSN on a national scale, there's going to be a reinvention on how we engage our healthcare. And it starts with the little things like this.
I completely agree. Thank you so much. And Rupesh, I wanted to give you just a couple minutes because then I think we're pretty close to our hour time and I wanted to leave some time for questions. But what were your final thoughts? Because you also highlighted to me that a big part of this to have a high success rate is also your interaction with patients to help them overcome the stigma of you offering a naloxone product.
So the main thing, first of all, this program is real. It does save lives. I've seen it happening in my store where I dispensed it to a patient's mom. She took it home. I had educated her how to use it. 3 days later, she came to pick up another box, and she basically told me, Rupesh, she saved my daughter's life. So that made me a believer of this program. Besides that, everybody, when they think about naloxone, they think they're drug abusers. We need to figure out a way to create a relationship with our patients and educate them that this is not, we are not judging them. It's the stigma. This is for them. It's not because they may take a high overdose on their opioids. A lot of patients are taking multiple medications and the interactions can sometimes create a problem for them. And we are giving them this product as a safety. Not only do we want to teach them, we want to teach their family members also. Well, and once you start identifying those patients, and all majority of us will see because of polypharmacy, a lot of patients are taking a lot of medications that can be dangerous for them. I think it's our ethical responsibility to help them. But when we help them, they will get a lot of professional gratification. That feeling is better than nothing, that I did something good today. And that's how I got into it. And I practice this every day and I try to identify and I keep every time my patients come for high dose of opioids or somebody that I've identified, I ask them, hey, I dispensed that box. Do you still have it? You don't have it. I keep track of it and we have had great success. And I'm thankful to this IDPH for having this program so we can at least be able to help our patients.
Well, I really appreciate that, both of you. And I want to thank you both for being here and sharing your thoughts. And if anyone is watching this at a later date, the recording of this presentation, please feel free to contact us at IPHA, the Illinois Community Enhanced Network, I-CPEN, and we'd be happy to get you started with naloxone dispensing. And again, I'm Laura Lakiri. You can go ahead and ask for me, and I'll go ahead and walk you through the steps. Thank you so much. Garth, that wraps up this part of the presentation.
Great, thank you. And one, as I've talked about this before with naloxone, when we talk with patients, if you have one of these at home as a fire extinguisher, you need to have naloxone. It's that simple. And just as you have home first aid kits, you have fire extinguishers, people should have naloxone. It's that simple. And I greatly appreciate you bringing up the our previous education program. We're looking at ways of making a new, revised, and concise version of that program, because if those of you who remember who took the original one back in 2017, it was almost 2 hours long. But we needed it to be 2 hours long at that time. Now we do not need it to be 2 hours long. So we're looking at more of a 15 to 30-minute version. And and the last point that I will say about the prescription monitoring program, when the reporting for naloxone is, of course, for the prescription sales. Unfortunately, right now, we don't have a way, and the Prescription Monitoring Program Advisory Council is still considering how we are going to even track, if possible, tracking for over-the-counter dispensing. So that's been a continued challenge that I know the PMP is trying to find solutions to, if possible. So, but just want to remind everyone of those things. So I'll now turn it back over to Lauren to wrap us up for the rest of the program.
Thank you, Garth. Okay, so I hope you guys enjoyed our program for tonight. Our next meeting will be in April. So details to come about our next meeting. If you guys have any questions or comments from these presentations or what you've learned, reach out to any of us. We would love to help answer and guide your way to a better pharmacy future. So yeah, thank you guys for everything.
Yep, and that will be on April 22nd. So remember, it's
Thank you, Garth.
the fourth Tuesday of every month. We got 5 Tuesdays next month, but we'll be on the 4th one. So we'll see you all then.
Thank you.
Good night.
Good night.